Have you ever noticed that suddenly intercourse feels uncomfortable, or you're running to the bathroom more often, or you leak a little when you laugh or cough, and no one warned you? No one explained why your body feels different down there. Instead, we whisper about it. We feel embarrassed. We assumed it's just aging. But what if I told you this is one of the most predictable, treatable, and biologically logical changes of menopause? By the end of this episode, you're going to understand exactly what's happening, why it's happening, and why your body is not failing you. Welcome to the Menopause Minute. I'm Cynthia Penner, menopause health coach and author of the Menopause Map book series. Today is a medical minute where we break down your hormones, your symptoms, and the science behind what you're feeling in a way that finally makes sense. Let's make this simple and empowering. The estrogen connection. Let's start with the foundation. Estrogen is not just a reproductive hormone. It's a tissue-supporting hormone. It keeps the vaginal walls thick, elastic, well lubricated, and rich in blood supply. It also supports the urethral and bladder lining. When estrogen begins to decline in perimenopause and drops significantly in postmenopause, those tissues lose some of their structural support. This is interesting because the vagina, urethra, and bladder all develop from the same embryological tissue. They are hormonally linked, so when estrogen shifts, they shift together. That is why vaginal dryness, irritation, urinary urgency, and even recurrent urinary tract infections can appear around the same time. It's not random, it's biological. And what is crazy is that no one talks about this. We are too embarrassed, too ashamed, too afraid that it's only happening to me. So, time for a science snapshot. You may hear the term Genitourinary Syndrome of Menopause, which shortened to GSM. This is the medical term used to describe the cluster of symptoms that occur due to estrogen decline affecting the vaginal and urinary tissues. It includes vaginal dryness, burning or irritation, pain with intercourse, urinary urgency, frequent urination, and increased UTIs. This is not a disease, it's a tissue response to hormone changes. Unlike hot flushes, GSM symptoms typically do not improve over time without support, but they are highly treatable. So why urinary symptoms increase? Now let's talk about the bladder. Estrogen helps maintain the strength and thickness of the urethral lining. When estrogen declines, that lining becomes thinner and less resilient. At the same time, collagen production decreases. The pelvic floor muscles may weaken, which is your supportive hammock under the bladder, and it is not as firm as it once was. So what happens? You may feel sudden urgency, leakage when sneezing or exercising, a sense that your bladder never fully empties, or more nighttime urination. This isn't weakness, it's hormonal tissues remodeling. Our bodies are intelligent and adaptive. They respond to changing chemistry. Sometimes that adaptation feels uncomfortable, but it is not betrayal. Time for a science snapshot. The urethra has something called a mucosal seal. This seal helps keep urine inside the bladder by maintaining slight pressure and tissue thickness. Estrogen supports that seal by maintaining blood flow and collagen in the urethral lining. When estrogen drops, that seal becomes less effective. The result can be stress incontinence, which is leakage with movement, or urgency incontinence, which is leakage with a sudden strong urge. Understanding removes the shame. This is biology. So vaginal tissues changes. Let's gently talk about the vagina itself. With lower estrogen, vaginal walls become thinner. Natural lubrication decreases. pH becomes less acidic. Protective bacteria decreases. This shift in pH allows different bacteria to grow more easily, which increases UTI risk and vaginal irritation. This is interesting because estrogen supports glycogen production in vaginal cells. Glycogen feeds beneficial lactobacillus bacteria. Those bacteria maintain a protective acidic environment. So when estrogen drops, glycogen drops, lactobacillus drops, and pH rises. See how beautifully interconnected this is? Your body is not drying up, it is responding to hormonal chemistry changes. And when we understand the chemistry, we can support it. So here are your supportive stepping stones. Let's break this down into what you can actually do next. Number one, open the conversation. First, talk to your medical health care provider. Vaginal estrogen therapy is low dose and localized. It does not function the same as systemic hormone therapy. For many women, it is safe and extremely effective for GSM symptoms. There are also non-hormonal options, including vaginal moisturizers and hyaluronic acid-based products. Silence keeps women suffering. Conversation brings relief. Number two, support tissue health. Regular sexual activity or vaginal stimulation increases blood flow. Pelvic floor strengthening improves support. Avoid harsh soaps or douches. Stay hydrated. Blood flow is nourishment. Tissue responds to use. Number three, protect the microbiome. Consider probiotic support for vaginal and urinary health. Avoid unnecessary antibiotics when possible. Address recurrent UTIs early. Your vaginal microbiome matters just as much as your gut microbiome. Number four, reframe the narrative. This is not decline. This is transition, and transitions require new support strategies. Your body is not failing, it is recalibrating. If you're experiencing these symptoms, please know this: you are not alone and you are not broken. If this helped you connect the science to your symptoms, explore the resources linked below for deeper guidance on navigating late perimenopause and early postmenopause with clarity and confidence. Understand the map helps, but using it is where relief begins. If this episode helped you feel seen and supported, don't forget to like, comment, and subscribe so you never miss a new Menopause Map Minute. Because understanding yourself inside and out is how you flourish through menopause.